Hello, Kerry.
Hello, Rena.
It's so nice to speak to you. I love the work that you're doing. Kerry, would you be able to introduce yourself to our viewers?
Absolutely. My name is Kari Lotzien, and I'm an occupational therapist in Alberta, Canada. I've had a, I started out working with government programs with children in hospitals and in schools at the beginning of my career. And for the last 18 years, I have had a private practice. We work closely with children from toddlers right through to teens in the school system, in private family homes. We do a lot of family support. So the idea is we really support the whole family unit around the child. Um, my practice includes both occupational therapy and psychology. So we have a very close knit team that work together to support families.
Great. And as you mentioned that we work with a I mean, I remember when I started working, I used to work only with kids and I thought that was all. But somewhere it felt incomplete because I thought I just have to work with kids. I would always give them a program and all, but I never worked with parents and parenting. So I love the concept of anchored parenting. Would you be able to describe what that means?
Absolutely. The concept of an anchor was gifted to me. My husband's grandfather used to refer to me as an anchor, and at the time I thought it was an insult. I thought he was saying I was the ball and chain and that I was no fun. And it was years later he said to me, "No, no, no." He said, "When the seas of life get stormy, and they always do," he said, "it's not our job to captain anyone else's ship. It is our job to be the anchor, that point of stability and safety that helps people to feel safe." And that really resonated with me to the point that I established my business around the concept. And when I think about anchored parenting, I think in my work over the last 18 years, I feel that sometimes, and all parents, I believe, want what is best for their children. We all want to support them in the way that we feel is related to the way we were raised, what we believe is best. And in my experience, what I see is some parents want to try to make things easier for children by changing the environment or preventing them from having challenges. And what we find is in that style of parenting, we can we can't prevent things from happening, as we have certainly seen this last couple of years, that unpredictable things happen, and we can't change that for our children. The other side is sometimes parents will be quite controlling. They want to captain their children's ship to say, if you do this, then life will be easier, and we want to give them advice because we love them and we've had more experience. We're coming from an adult mind. And what I've found is that for children to develop the concept of resilience, learning to have self-esteem, knowing that they can manage their own lives. And in the lifespan, as we work towards that through challenges, through overcoming obstacles, children get the sense that I know how to do it, but I also have that safety net of someone who understands and who can support me to help me go in the direction I want to go. And I believe that that concept is what creates more resilience for our children.
So it's about balancing their roles and not like, you mean it's not about doing too much or too less, not micromanaging them, letting them go through their struggles because that's how they learn to develop their skills. Is that, have I understood it correct?
Yeah,
Yeah.
And I think that absolutely when we can be there to be that stability, to say, oh, I can listen, I can help, I can guide without taking over. So it's about finding that balance. And when I think of an anchor, I think of water, where it's kind of always changing. There's always a little bit of a dance. So there's no one right way, but that it changes as life changes, as the stage of life changes for the child, as the situation changes.
And whenever the children are finding themselves in those waters which are always changing, which means when they find themselves in the mess of those uncomfortable emotions, we are there as an anchor to help them validate it and feel it and then express it. Is that what it is about?
Yes.
Kari, what is trauma informed practice? Before I knew about trauma, all that I knew about trauma was trauma, physical trauma. And as I learned more, as I read more, I understood how there's this big T trauma and there's this small t trauma. So what is this trauma informed practice?
My definition that I use is from Peter Levine, who has wrote Healing Trauma and a lot of great literature on the topic. And it's any time that our ability to overcome the situations that we're in is perceived as being inadequate. So I think in the beginning, I used to think of the big T trauma, I think just like you, where it was car accidents, it was major illness or abuse. And what we're learning over, and what I've certainly seen over the last 18 years in my practice, is that those little T traumas where children may not have felt safe and not always in a situation that we may have even defined as trauma. We may not have even recognized in the moment, but it can be experiencing a significant illness. It could be even a fear of being left alone. And then I think my area of practice is in what I call the complex developmental trauma. Bessel van der Kolk talks about these trauma that occurs on an ongoing basis, where children don't feel that sense of a secure, compassionate caregiver that is really attuned to their needs, where they learn that safety and then they explore off of that. And the challenge with that type of trauma is that those children often don't say anything about it, because to them, it's just everyday life. It's just what they've learned. But that type of trauma, as well as those big T traumas, can affect the way that the brain develops. Because as we know, our brains as human beings continue to develop well into adulthood. So when those traumas happen, it can affect the way that the brain develops, but then it also affects the way that the brain processes information. So what we see is that both children, and now I'm understanding adults, because a lot of the adult population is also experiencing the effects of a traumatic brain throughout their childhood, and then we're parenting and leading from that position. And when we have trauma in our lives and our brains process information in that way, what we find is we have the hyper activity in the area of the brain responsible for survival. So we focus more on staying safe by, we're familiar with the fight, flight, or freeze responses. But when those show up in little ways of not wanting to deal with situations and we try to kind of avoid challenge, or we come across as quite confrontational or, argumentative, not being able to find that common ground, that to me is the key of trauma informed practice. It's seeing beyond the what people are saying and really understanding that when we come from a place of fear, when we don't feel safe, that our ability to process information and to develop relationships is really limited. And when we can help work with the nervous system to create that sense of safety and calm, what I refer to as anchored, it opens the gates so that those higher levels of the brain where relationship and learning and all of the academic piece can happen. And I
Exactly,
think when we
exactly.
understand,
I'm sorry, I'm interrupting. And exactly, I completely agree, because if academics and all is what mostly people are talking about, but if the child is not feeling safe, he is always going to be in a state of hypervigilance, hyper attuned, like really distractible. He's definitely not feeling safe. So I completely agree with you. And I kind of even relate to it, because as a child, even small little things, when I would ask something from my parents and when they would not give me, and I would cry, and I would cry and cry and cry, and nobody would come and soothe me. Those memories are still there in my mind as emotional wounds. I was like, oh, I'm not loved. They don't love me. Maybe I'm not worth it. So those are the kinds of feelings that I brought them along from my childhood to, like to where I am. And it took me a lot of time to work on it. So I completely relate and agree with what you're saying. And beautiful. I love the way you're trying to, like the way you're explaining it also. I'm sorry, I'm interrupted you. You were saying something about academics, and I was like, oh, this is what I'm feeling.
no, and I want to just tie into that because I think, as a therapist, I think that was my biggest learning is, as you referred to, we have our own experiences in how we got to the place we did. And when I reflected on my own childhood, I thought, I wouldn't have defined my childhood as traumatic. I thought I had a roof over my head, I had food in my belly, I was not physically harmed, and I thought, why am I like this? Why am I so anxious all the time? And it wasn't until well into my adult years that I looked back on my own childhood. And I had a very unique experience quite young where I had an uncle that was brain injured. And he was brain injured when I was between 3 and 4 years old. He was one of my primary caregivers, but he had a severe frontal lobe injury that dramatically changed his personality. And he went from being my anchor to just adoring me to being this very scary individual who, couldn't control his emotions, and he would cry and he would yell. And I was so afraid that I learned how to just be very independent, to stay out of the way, to not really ask for much, because my mom then helped to look after him. He was often in our home, and then my younger siblings required care. So I always looked at, she was so busy. And when I needed something from her, it felt I was asking for too much. So my outcome of trauma didn't necessarily, there was certainly hypervigilance and being very aware of what other people thought, but it also showed up as excessive independence, where I just thought, I need to figure this out on my own. And I think, as you referred to, when we learn more about that ourselves and can have that compassion for ourselves, it really changes the way we view children and families, even parents. Right? I feel like I'm a lot more compassionate to parents when I see just how they're showing up. It's not in a place of, not wanting the best for their kids. It's they're really coming from their own childhood and their own wounds as well.
Exactly, exactly. Because that's how, the whole thing about trauma and working on myself and everything started when my son started having behavioral issues. And I thought I need to fix him, and he has a problem. And that's when I realized, no, it was me. It's my anxiety. I took him to a developmental pediatrician, and I'm so happy because she said, there's no diagnosis, Reena. You are anxious. I'm like, stop it. I'm an occupational therapist. I'm training people. I'm teaching parenting. You can't tell me, like I am having a difficulty. And I think it was a beautiful journey. I really kind of agree with what you're saying. And I want to really highlight this because, as parents, we feel we are doing our best. And definitely we are all doing our best. But we are parenting our kids from our own trauma lens. And when we come out of that, and when we in fact, I feel when we are more compassionate to ourselves, we see our kids' tantrums, their meltdowns, also through the lens of compassion and not by being triggered. Do you agree with that?
Absolutely. And I think that the other side of that is, as parents, sometimes, especially when our kids have meltdowns or tantrums in a public setting, we feel like we're doing something wrong, that our kids are bad. And we want to try and correct that. We want to fix it. And so many times it's just a matter of having that space and that compassion. And when we can regulate our own nervous system, we can
Yeah,
create that space for them to calm.
true. It's just that we are so scared of being judged that we are judging our own kids, and we do parent in a way that we don't want to. So thank you for highlighting that. It would really help people who are listening. If it's a tantrum, like parents come to me and like 2.5-year-old, 3.5-year-old, and they're like, my child is always moving all the time. He's jumping all the time. He's climbing all the time. I said, like, that's what he's supposed to do at that age. They're not mini adults. So I think wonderful. Thank you for highlighting it.